In this video today, we're going to talk about back pain and when are the 5 different times it's serious enough that you need to see a doctor sooner rather than later. If we haven't met, I'm Dr. Orlando Landrum, an interventional pain and regenerative medicine specialist who helps patients, their family members, and people who care about them understand why you have pain, what you can do about it, and how to be able to win the battle against pain to punch it in the face and get back to leading the life that you deserve. Today, we're going to talk about 5 different times when you need to see a doctor sooner than later for back pain. Number one, if you have lower limb pain, weakness, and in particular, if it's associated with difficulty being able to control your bowels or your bladder. In this construct, you might have a disc that's causing pressure against the nerves. You may have something that's called cauda syndrome, meaning you have a compression against a whole group of nerves at the bottom portion of the spinal cord. And you may have other things that are causing a compressive element against the nerve. And that's something that you want to have evaluated sooner than later. It's not something that you can just kind of hope will go away. You need to see a doctor sooner than later so you can get evaluated and treated if necessary. Two is if you have back pain and it's associated with fever or night sweats. There can be a number of different things that can cause this, anything from cancer to a bacterial infection to tuberculosis. And although those things may be rare, what we want to identify is if you're having back pain and night sweats, why? And seeing a doctor sooner than later is always a good idea when you have those two things in conjunction. Three is if you have back pain and it's worse at night or when you're trying to get some degree of rest. If that's the case, it very well may be caused by either an infection, possibly cancer, and those would be part of the differential that you really want to have your doctor identify so that she or he can make a determination. Is this something more serious? Or is it something like a muscle or joint or potentially disc bulge that might be able to be treated with conservative therapy? If you're having problems and the pain is worse at night, then you definitely want to have that evaluated. If that back pain comes with the construct of a significant degree of weight loss or loss of appetite, you really want to get that evaluated. It can be associated with some degree of cancer. And just kind of making a quick divergence, I saw a patient that was seen in office and previously had evaluation by a healthcare provider. And that patient told me, hey, yeah, I've had some night sweats and I've had a 30-pound weight loss, which I haven't wanted to have. And it's happened over the course of 2 weeks. And we ended up evaluating that patient, and the patient did have a cancer diagnosis. So those type of things need to be looked at aggressively, and it's not something that you want to wait on. You want to be able to identify it, get after it, and fix it. And the fifth condition is if you have back pain and it's associated with other accompanying joint pains. So if you have elbow and knee and shoulder issues, frequently we try to tell ourselves, oh, it's just other things that are kind of giving me some problems here and there. But you may be having an arthritic flare. And that arthritic flare might need to be assessed either by a pain physician or potentially by a rheumatologist so you can address it, get the best response that you can, as opposed to waiting on it and then having to have a more severe involved treatment. If this video provided you some value and hopefully gave you some insight about things that you need to do in order to make sure that you're winning the battle against pain, please hit the like button if you feel it's warranted. And if you think you want to learn about other ways to be able to treat pain and be able to get improved function, hit the subscribe button. Again, we appreciate you tuning in and have a great day and be safe.